the health technology management innovation in the time of COVID. Yesterday was a very successful program talking about asset management, parts and manuals, strategic disaster planning. And this kind of reminded me of whenever I got into the field of clinical engineering in 1969, basically coming from research and about the same time that Cesar Cáceres coined the word clinical engineering. You know, I was first asked to talk about the maintenance management in the VA in 1969 and found out they didn't have any program. And I got to develop a clinical engineering program for the VA in 172 hospitals in 1972. Started out with working with an industrial engineer and 3 hospital directors who were convinced that they had everything. And then after they looked at it, found out they didn't have anything. So we developed a program and found out that, you know, we didn't have any clinical engineers nor any technicians. And I got to work with the hospital engineering people in central office to implement the plan we developed. And as we look at today's program, training was a big part of this. We looked at training clinical engineers in management, interaction with the clinical and administrative staff, construction, disaster planning. And we had to hire clinical engineers, and we put them through a 2-year training program. So that some of them became hospital engineers, some of them became physicians, some of them became directors, like one of our speakers today, Jennifer DeFresco. We also had to train existing people that were working on medical equipment. We didn't have technicians, so we had to train plumbers, electricians, and mechanics to repair and operate equipment. We also trained them in management. And one of those technicians actually went up the system and became a manager for 1/4 of the hospitals in the system over that time. So management was a very important thing. We also established a document and manual center for safety and investigation. So this kind of reminded me, you know, I haven't been active in the field for several years now, but I've been working with various, with the CED and with the Alliance. And now I'd like to turn it over to my co-moderator, Riad Farah, from Lebanon. So Riad.
Thank you, Dr. Ware. I will introduce myself quickly, but honestly speaking, I'm so honored to co-moderate with you, Dr. Ware. Your reference and you have a huge experience. I have 30 years experience in clinical engineering, working at St. George Hospital in Lebanon. It's a small country in Amro region. Worked with health technology management and assessment, purchasing, training, accreditation, quality, hospital architecture, and teaching. I'm a WHO consultant expert. Me with a group of consultants prepared the pre-qualification, and I'm currently helping Amro region and IFMBE collaborator. We had a dramatic accident in Lebanon back in August with a huge explosion that devastated the whole city and the hospitals. Clinical engineering was totally different after the explosion. So we need to innovate. We need to come up with ideas. We had to repair without parts. We had to invent, to change the functionality of departments from emergency to ICU and from floors to ICU. It was lots of experience, so stressing, but clinical engineers have to always go out of the box. And here it links just as you did, Dr. Ware. It's a small link to the great webinar that we saw yesterday. And we had lots of lessons learned. Rosanna, for example, she invited all clinical engineers not to wait for government to act and to work, and clinical engineers to innovate and think out of the box. And Dan, when he said that the clinical engineers are like Cinderella, where they never invite us to the ball. So are we ready for future pandemic? That was a good question as well from Dan. And Toby and Dazine, they showed the importance of proper asset management and necessary for informative decision-making. And Ray to connect the puzzles to make health technology system better. And Fred beating the drum for clinical engineering for disaster preparedness. And last but not least, Yadin to train the clinical engineer on facility management, and together we can make it better. Of course, there are lots of other lessons that we learned yesterday. And I'm so excited about today's webinar as well. We have a wealth of information, great experts in clinical engineering. I'm so excited to co-moderate with you, Dr. Ware, and to present the presenters and to listen to the lessons that they're gonna share with us.